So I'm really excited to be here tonight to talk about how innovative digital strategies have really driven radical access in rural healthcare. And we'll start with a story, of course. I want you to meet Marlene. Marlene is 7 months pregnant. She lives in a small rural community, no public transportation, really limited access to healthcare. And she comes home at the end of a long day at work and lays down and starts to notice some sharp pains in her stomach. She thinks, well, I've been on my feet all day, it's been a long day, I'm just gonna lay here for a minute and see if it passes. But the pain actually gets worse, and then she starts to notice some changes in her vision. So again, she's faced with the scenario of, do I keep waiting it out? Do I make that hour-and-a-half drive that it takes her to get to the nearest hospital or the emergency department? Do I wait for symptoms to get worse, wait for them to get better? What do I do? And we've all been there. I've been there with a sick kid in the middle of the night with a high fever, and you're trying to decide when's the right time to call the doctor, when do you know to go to the hospital? Or, us personally having symptoms and trying to make that same call. But I don't know about you, but I'm having a hard time deciding that, and I live 15 minutes from a hospital, let alone an hour-and-a-half to make that drive. But thankfully for Marlene, something different happens this time. And that's because she had the opportunity to enroll in an OSF On-Call Connect program that's specifically designed for pregnant women and postpartum women. And this program offers 24/7 access to a care team. So because of that, through an app on her phone, she sends a message describing her symptoms, saying, I don't know what to do. And within 2 minutes, a nurse calls her. The nurse performs triage, so that means the patient is sharing what their symptoms are, and the nurse is using evidence-based medicine to go through a decision tree of sorts. The nurse identifies this as a good opportunity to immediately escalate her symptoms to a virtual visit with an advanced practice provider that specializes in obstetrics. They make the decision together that yes, she should absolutely make that drive to the emergency room. So Marlene arrives at the emergency room and they pretty quickly diagnose her with preeclampsia. So that's a condition where extremely high blood pressure, and it can cause a lot of dangers for the mom and the baby, and if not caught early, can be fatal. But because she worked with her care team, had immediate access to care, they caught it early, they started her on medication to lower her blood pressure, and through close monitoring for the rest of her pregnancy, some of that monitoring actually coming right to her door through a mobile unit that provides care directly to patients, she delivers a healthy baby. But Marlene's not alone, and she was really fortunate to have a great outcome. But so many like her live in rural America. Over 60 million people in our nation live in what's designated as rural America, according to the US Census. That was data that was done recently. So that's 19% of our population, or 1 in 5 of all of us, live in what's designated as rural America. Serving those patients in rural America are rural healthcare facilities, rural hospitals. And from 2005 to 2023, 146 hospitals closed in our country. 146. And I don't have great news about the rest of those that are still there. Of the hospitals that are still open in those rural communities, nearly half are operating at a financial loss. And that's data from the American Hospital Association. They're operating at a loss because, to make it as simple as possible, we are getting paid less. Hospitals are getting paid less for the care that they provide by insurance companies, by Medicare and Medicaid, while at the same time, expenses are going up. So we all walk into the grocery store and pay more for milk and eggs. Within a hospital, we are paying more for gloves and masks, but especially for things like pharmaceuticals, the medications that we have to administer to take care of our patients, and for labor. Labor is one of the highest drivers of high expense. We have a national shortage of physicians and of nurses, among a lot of other healthcare professionals as well. And you think if we have difficulty recruiting doctors and nurses to larger cities or more urban areas, it's even more difficult in a rural area. And so because of that, specifically for labor, we have something called travelers. So it's a nurse and physician, we call them locums. They're short contracted assignments, but you pay so much more for those services to have them available at your facility, to be able to staff to keep those services open. And the most affected areas are behavioral health, which is one of the most needed care providing to our country right now, but also, as we saw in our example with Marlene, OBGYN services. And that's because for obstetrics specifically, it's very expensive to provide that care within a hospital, not just for the physicians and staff that need to be there, but some of the supportive services like anesthesiology that have to be available 24/7 if you're delivering babies. But the cost of providing those services, also coupled with declining birth rates in our country. We're delivering less babies, and in order to keep certain medical programs or clinical capabilities open at a facility, you have to be competent in the care you provide. So there's minimum numbers of deliveries, for example, in order to keep those services open, to keep your staff competent in knowing what they're doing and delivering that safe care to a patient. So we have a crisis in rural healthcare, absolutely. But I'm going to spend the second half of my time with you to talk about some really innovative solutions that we've been able to deploy. So our solution is a digital-first model that's leveraging technology to be able to meet those patients where they are in their healthcare journey. First, same-day virtual visits and digital triage. At the beginning of our time together, and I talked about Marlene, and she had that triage and virtual visit. We're making that available not just for obstetrics patients, but patients with a variety of diagnoses. There's a phone number that they can call that nurse can walk them through their symptoms and help them decide what that right level of care that they need at that moment. Sometimes being an immediate escalation to a virtual visit with an advanced practice provider or a physician. The second is remote patient monitoring. This is so cool. There's a variety of disease diagnoses that patients can qualify for this monitoring. For hypertension, for diabetes, for COPD, you can have a text loop available to check in and monitor. So for example, if a patient is diagnosed with hypertension, they might be asked daily to text their blood pressure on this text loop. And it's great for a patient to be aware of their current condition and to self-report, but the secret sauce is the care team that's on the other end of that text loop. And they're watching for patterns. We're using analytics, we're using data to understand if there's triggers. And you think of like a red, yellow, green. Patients are in the green, they're good, nothing's wrong. Their self-reporting looks great. You get into the yellow, then the care team can reach out. They can say, hey, time to, we're concerned about this. Time to get into your doctor for a visit. All of this being done to prevent those patients from getting sicker and ending up in the emergency room or where they don't have access to care and they have a poor outcome. We've deployed mobile health units. I mentioned this already within the story of Marlene as well. These are mini RVs. They're equipped. They're like a medical office on wheels, and we send them out to the areas where they're needed the most. In rural communities where there's limited access, or in urban communities where there's not public transportation and there's healthcare deserts there as well. But they provide vaccinations, preventative screenings, and we do have one that's specifically outfitted to take care of pregnant and postpartum moms. And then finally, community-based teams. We have teams that are boots on the ground. They're called community healthcare workers. We actually call them digitally enabled community healthcare workers. So they are in the market, building trust with those patients, helping them navigate to social resources they might need. If they need access to food, if they need access and help filling their medications for the prescriptions that they've been prescribed. But most importantly, helping them with so many of these digital tools that we have and that we're enabling and we're providing. We have programs where we're giving that iPad to that patient so that they can have that connection to the services and the solutions that we're proposing. And that community health worker goes alongside them to help them utilize that to ensure that they're getting the care that they need and know how to use the technology that we're putting forth. So we started with people and we're gonna end with people. I'm here to say we are all shared in this responsibility to address the challenges within rural healthcare. And I'm blessed to work for OSF and be a part of the solution that we're really rewriting that script for rural healthcare and showing what's possible when innovation, when technology, when digital health is combined with that mission and purpose. Thank you.